One of the main things about studying with ATS, the Association of Traditional Studies, is it's such a foundational level of skill and understanding. It really teaches you the basics that allow you to be engaged in a treatment from the first second till the last, during every moment of that treatment, to be trying to do whatever you can in as skilled a way as possible to affect the outcome of what you're doing. Because it gives such a foundational level or a fundamental language of experience and tactile skill and perception, what it really does is give practitioners a language that they can genuinely speak to each other in, and a language they can genuinely speak to patients in. A lot of Chinese medicine is so bound in terminology that practitioners don't necessarily understand, and the patients definitely don't understand. Many of the diagnoses or the words we would use are Chinese. People don't understand what we mean by that. But when you're on the level of experience and what you can feel changing in your body, that is a language, that's the language of disease, after all. When someone is ill, that's the language their body is speaking to them. Discomfort, pain, warm sensations, cold sensations, movement sensations. If we can practice a medicine where that is our language as well, and how to manipulate those sensations is our language, we can not only communicate directly with the patients and with the patient's disease and with the patient's health in their own body, but we can also communicate to each other as practitioners. So you can improve as a practitioner because suddenly you have people whose language you understand. And that's really the main work of ATS up to this point, has just been teaching that language, because that people don't have that language. People didn't even know that was a language you're meant to be able to converse in Chinese medicine. And so studying with ATS begins to really bring together not just your own skill set and your own observations of what works, but bring together a body of people who share that common understanding. That's a genuine understanding, a tangible understanding, as Andrew would have it. And then being able to go into a clinic where you're seeing that enacted to treat conditions, difficult conditions, in often an extraordinary way, with extraordinary success. That really changes your perception of what you can do and what Chinese medicine can do, and gives you more and more motivation to keep doing it and doing it better. One of the main things that you really need to begin with in Chinese medicine is just the practical ability to touch and interact with your patient. You can forget acupuncture, you can forget terminology like bodywork or massage or acupuncture. You're touching. Whether it's with a needle or not, you're touching. And really what Andrew is teaching is quality of touch. And humans are great at reading quality of touch, although we don't necessarily, we can shut that down if we want to. If the practitioner who's treating you is not touching well, you can sort of ignore that. But if they start really touching you with intelligence, with intent, with clear intent about what they want to do, you can tell. Again, whether it's through a needle or whether it's with your hand, it's a fundamental skill that anyone treating with their hands or even not with their hands needs. It's the most fundamental language of how to approach somebody, anyone, whether you're treating them deliberately or not. So quality of touch is really what ATS teach right from the get-go, right from the start. And that quality of touch only increases, only gets better. Your mental focus can only increase and progress if you keep doing the training, the Dao Yin training, keep really exposing yourself to this information and staying in the loop of the teaching, staying within that influence of people like Andrew and Julianne, you just keep getting better and better, and it becomes more and more absorbing. And after all, that's what this needs. This kind of medicine needs your intense focus. The quality of your focus will eventually be directly linked to how well you can treat something. In a way, this material doesn't belong to anyone in a funny sort of way. It was taught to Andrew. It was taught to Andrew's teachers. Anyone can do this. Anyone can learn and anyone can improve. Obviously, as with anything highly skilled, some people seem to be naturally gifted. Other people seem to be not naturally gifted, and the rest of us are somewhere in the middle. But anyone can improve at this. We've seen it time and time again. In fact, as I often say, it really doesn't matter what kind of acupuncture you use. It doesn't matter what kind of physical therapy you use. You can't be exposed to this material and not get better at it if you put the work in. It will improve whatever you are doing because it's such a fundamental skill. It could not improve you if you actually did the work and took notice of what's being said.